Hello, Assalamu alaikum, everyone. Today I am starting with the 9th lecture on the topic of thanatology. We are discussing the early changes after death. In the previous lecture, I discussed the early changes like contact flattening and cooling of the body. And today we'll discuss the next change, that is the hypostasis or livor mortis, also called as post-mortem staining. We'll understand its basic definition and how it progresses, how much time it takes to develop on, and when it is fixed, how we can determine that post-mortem staining has been fixed. Then we'll discuss various colors of the post-mortem staining, which help us in determining the various causes of death. Then position of the body, where it is lying, and if it is in water, what changes will be seen regarding hypostasis. So we'll starting with the topic of hypostasis now. Okay. Hello everyone. So now I'm starting with the lecture number 9 on the topic of thanatology. Bismillahirrahmanirrahim. In continuation with the early changes which we have been discussing in the previous lectures. So the learning objectives of this video lecture will be that after the end of this lecture, we'll be able to understand the definition of the lividity, what is the color of lividity, and various other colors which help us in determining various cause of deaths. Then how the lividity progresses, the progression of the lividity, and how to determine that the post-mortem lividity has been fixed, and what is its distribution, the distribution of hypostasis, that means on which areas it develops. Then what is the effect of change in the position of the dead body after death when the post-mortem staining has not been fixed or when it has been fixed. Then if the body is in water, how the post-mortem staining will manifest. So starting with the topic hypostasis, it is also called as post-mortem lividity or post-mortem staining or livor mortis. Post-mortem lividity, this is how it is seen when the body is lying supine, that is, the face is facing upwards and the whole back of the body is lying on the surface where the death has occurred. Then these are the areas at the back where the post-mortem staining is seen. The post-mortem lividity, it is a mechanical phenomenon. So please keep this thing in mind, that this is a mechanical phenomena which is defined as post-mortem discoloration. And it is the staining or discoloration of the skin and organs of the body due to accumulation of blood because of gravity and arrest of circulation, which results in distension of toneless capillaries and veins of the dependent parts of the body. So it's accumulation on the dependent parts of the body because of the effect of gravity in the toneless capillaries and veins. And it is also defined as capillovenous engorgement of toneless blood vessels of the dependent areas of the body as the blood gravitates to those positions after death. Then about the color of the lividity. The color of the postmortem staining is the same as that of the color of the blood at the time of death. Initially, it is bluish pink. Later, it becomes bluish purple or dark blue. And in fair colored skin, the color can better be appreciated. Then about the development of the lividity, how it progresses, in which time it is progressing, and why it develops. This is important to understand. After somatic or clinical death, the circulation stops and blood remains in fluid form for some time, for some hours. Oxygen, the blood, which is carried in loose combination with hemoglobin, is being supplied to the tissues till the molecular death. As we very much know that anaerobic glycogenolysis also is going on, which is responsible for the flaccidity of the blood, flaccidity of the body. So when there is no more pumping of the blood by the heart, oxygen is gradually decreased, hemoglobin is reduced, and it now will appear as blue color. And due to the gravity, the blood flows down to the dependent areas of the skin and the viscera. Then about the progression of the hypostasis, how it progresses. Initially, it appears as dull red small mottled patches, which appear within 20 to 30 minutes after the death on the dependent parts of the body. That initially it appears as small red mottled patches within 20 to 30 minutes, which then later on increase in size by coalescing together. They coalesce together and become broader patches in next 3 to 6 hours. When the postmortem lividity is fully developed and become fixed in about 8 to 12 hours. And this depend upon the temperature and other conditions which we will discuss later on. And this phenomena is not due to coagulation. So keep this thing in mind. This is a mechanical phenomena. It is not due to coagulation of the blood, but it is due to stagnation of blood in the dependent capillaries and toneless veins, which is a mechanical phenomena. Then how we can determine that postmortem staining is fixed? This is a simple procedure that we apply the pressure with the thumb of our hand, and if it bleaches or blanches the lividity area, that means the lividity has not been fixed and duration is less than 6 to 8 hours. And as the discoloration is due to filling of the blood vessels, it will not appear on the areas of contact flattening. So areas which are not in contact flattening, in those areas it is developing, and you will apply on pressure on those areas where the postmortem staining is there, not on the dependent regions which are showing the contact flattening. So when it will not bleach away, then the postmortem staining has been fixed. Now about the distribution of hypostasis. Mainly it is affected by two factors: the gravity and the position of the body after death. And the areas of distribution, they are mainly externally on the skin and internally on the viscera. So because of the effect of the gravity, the blood will flow down to the dependent areas and will be evident in between the areas of contact flattening. So how it appears externally, it is appeared as we know commonly after death, the body lies in supine position. So the postmortem lividity develops on the dorsal aspect of the head, back of the neck, back of the chest, extensor surfaces of the upper limb, and the flexor surfaces of the lower limb. So this is the back of the body, which is showing hypostasis in between the areas of contact flattening. And it is not present in the areas of contact flattening, as in these areas, the filling of the capillaries and veins will be prevented by the pressure of the weight of the body. And the areas of the contact flattening in supine position will be the back of head, back of shoulder, back of buttocks, back of calves, and heels. So these will be the points of the contact where the hypostasis will not be evident as due to weight of the body. And postmortem staining will be seen in between those areas of contact flattening. It will also be absent over the areas of tightening or constriction due to tight clothing or pressure due to some protruding object. If someone's arm or hand is underneath, it is pressing, then it will not be developed in that area. So it will be absent on the areas of tightening or constriction of the tight clothes, like the braziers in the females or other clothings, and by pressure of some protruding object. So distribution of postmortem lividity externally in supine position, postmortem lividity will be found on dorsal aspect of the trunk, posterior aspect of the head and neck, dependent areas of the upper and lower limbs, and more marked on lobes of the ears and tissues under the nails of the fingers. So this is how it appears. The body has been turned upside down to show the postmortem staining. The whiter areas are the pressure points of contact flattening, and you can see there the postmortem staining has not been developed. This is another picture showing the postmortem staining in between the areas of contact flattening. This is another photograph. Here you can see there are tightening bands or rings. This is as a body of female, and the strapping of the brazier and the undergarments. These are the pressure points, and there also the postmortem staining has not been developed. This is another picture. Here the hand was underneath, and you can see the pressure marks which has been by the pressure of the hand, and the postmortem staining has not developed there. Similarly, the hand was on front, the body was prone, the upside was down, the hand was on the abdomen and chest, and on this pressure point, the postmortem staining has not developed. Similarly, this is another pressure point. You can see the postmortem staining is not developed. So if the body lies on the facing front of the body upside down, that is, if the face is facing downward, in contrast to the normal position when the face is facing upward. Now, The postmortem staining will be distributed on the front as face and front of the body is facing downward, and this will be now dependent area, and the body remains. If in sitting position after death, then the hypostasis will be present on the lower half. So this is the altered positions, that if the face of the body is facing downward, that the front of the body is downward, then the postmortem staining will be developing on whole front of the body except the points of contact flattening. And if in sitting position, then the lower half of the body will be showing the postmortem staining. Similarly, if the body remains suspended after hanging, the hypostasis is confined to the lower abdomen, thighs, external genitalia, legs, on the hands. That is the lower parts of the body which is dependent. Here you can see the body has been suspended with hanging, and the lower parts, the lower limbs, the genitalia, the abdomen, and the forearms and hands is showing the hypostasis. This is the same body after it is removed from hanging. And this is another view that the postmortem staining is on lateral side and on the face. Then about the change in position of the body after death. This is important, that when the postmortem staining is developing, the change in position, if it is done before the postmortem staining has been fixed or not, we will discuss that. If the position of the body is changed before the postmortem staining is fixed, then these patches disappear and slowly will reappear on a new dependent position. That if the postmortem staining has not been fixed and the body position is changed, these patches will reappear on the next dependent position. But some degree of faint lividity will remain on the original areas. That will tell us that this was the original dependent position and the body position has been changed because the postmortem staining was not fixed and it has now developed to the next dependent areas. And if the position of the body is changed after the fixation of the lividity, there will be no alteration because now the blood cannot flow through the toneless capillaries because it has now become fixed. It will not change its position. And if the body is found in an altered position, that body is prone and the postmortem staining is present on the back, that means the body position has changed. So this is medically important. It can tell us how the postmortem staining help us regarding the change in position of the body after death if someone disturbs it. Here you can see the postmortem staining which is developed on the front of the lower legs, and the pressure points are the front of knees, front of the lower half of the calf and the toes. And now when the body was supine, the postmortem staining remain on the front, not shifted to the dependent back areas. And if the body is in water, and then it depends where that water is stagnant or it is flowing. In deaths due to drowning, in stagnant water, as the body usually floats, face being downwards, with the back of the chest and back of the chest at the highest level. So the head and the face is dependent. So in this position, the postmortem staining in stagnant water will be developing more on the upper half of the body, shoulder, neck, and the face and head. So lividity is most marked on face, over the front of the trunk, on the limbs, as these parts being heavier becomes dependent and remain lower than the rest of the body during floating. And if the drowning is in running water, then the body is constantly changing its position. It may be rolling and constantly changing its position. So the hypostasis doesn't get time to develop on, and the hypostasis will not be developing or will not develop at any part of the body. So summary of this lecture is that in this lecture we have learned about the definition of the hypostasis, what process it is, as it is a mechanical process, what is the color of lividity, and how it helps us in determining cause of death, then how it progresses, how much time it takes to develop on, and how we can determine that the post-mortem staining is fixed. This is a simple test. You just apply pressure with the thumb of your hand, and if the area bleaches, that means the post-mortem staining is not fixed, and if it doesn't bleach, that means it has been fixed. Then the distribution of hypostasis, externally it is on the back when the body is supine, so areas of hypostasis can be seen at the dependent region. Then what is the effect of change in position after death? If the post-mortem staining has fixed or not, we have understood that. And if the body is in water, if it is in stagnant water or running water, we have come to know that how it will develop. Thank you very much. So this is all about the 9th lecture, and we'll carry on to the next lecture soon, inshallah. Take care. Allah.